All right, let's jump right in. Today, we're talking about something really critical at the intersection of healthcare and tech. We're going to look at a program called AI Care Agents 247. It's designed to help our nonprofit healthcare sector, the clinics and organizations on the front lines, deal with these super complex, high stakes world of AI. And we're going to get into exactly why this work is so important, especially right now.
So, this really sets the stage for everything we're about to cover. Think about it. We have these amazing community health clinics, these advocacy groups. They're the ones protecting our most vulnerable people. They're our protectors. But now, as they start using AI to make care even better, who's protecting them? Who's watching their back when it comes to all the crazy technical, legal, and ethical risks that come with AI?
Okay, here's how we're going to break it down. First, we'll look at the big challenge AI presents in healthcare. Then we'll get into the solution, AI Care Agents 24/7, and how it works. We'll also see how it's about more than just rules. It's about equity. And finally, we'll cover the blueprint that makes the whole thing trustworthy. Let's go. All right, first up, the challenge. You have to understand, for a nonprofit that's all about healthcare, bringing in AI isn't just like getting new computers. Nope. It's like stepping into this incredibly dense, kind of dangerous maze of rules and regulations. Okay, look at this timeline. The thing that should jump out at you is just how fast everything has changed. I mean, for decades, AI policy was just something people talked about, a philosophical thing. But then, bam, in just the last few years, it has absolutely exploded into a very real, very urgent legal problem. We've gone from, let's see what it can do, to, oh wow, we need to make this safe. And that shift has left so many organizations just scrambling to keep up. And this is what that explosion looks like on paper. If you're running a community clinic, this isn't just a boring list of acronyms. It's a minefield. You've got your classic federal laws like HIPAA that you've always had to worry about, but now you have to stack California's cutting-edge AI laws right on top. The complexity is it's staggering. And get this, one wrong move, one tiny misstep, and you could be looking at fines that could shut you down, or even worse, losing the trust of the community you serve. And let's be really clear about what's at stake here. This isn't some abstract risk on a corporate spreadsheet. We are talking about real people and real harm. An AI with some hidden bias could lead to a wrong diagnosis for a patient. Sensitive health data could get leaked. And that trust a community has in its local clinic, it could just evaporate. The consequences are absolutely immense.
So, with a challenge that huge, what's the answer? Well, you can't just throw a generic fix at it. You need something specific, something targeted. And that's where AI Care Agents 247 comes in.
And here's what makes it so special. It's all about focus. This is not some generic one-size-fits-all tech company. It was literally built from the ground up to solve one very specific, very hard problem. How do you manage federal HIPAA rules and California's brand new AI laws at the same time? And crucially, it's designed just for organizations that are driven by a mission, not by making a profit. This chart really lays it all out, doesn't it? On one side, you've got your generic for-profit AI solutions. They're often way too expensive, and frankly, they just don't get the nonprofit world. But on the other side, you have AI Care Agents 24/7. It's tailor-made, it's built to prioritize the public good, and it understands that nonprofits don't have unlimited budgets. For anyone thinking about funding this kind of work, that distinction is everything.
Okay, that all sounds great in theory, right? But how does it actually work? How do you take all this high-level expertise and make it practical and accessible for, say, a super busy community clinic?
Well, they do it with this, the Certified AI Compliance Officer, or CCAICO. Now, this isn't some idea they just pulled out of thin air. It's a model that's built on what top policy research says actually works. The whole idea is to embed an expert, a real certified professional, directly into the organizations that need the help the most. And the process they follow is super clear and structured. First, the CCIOCS officer comes in and does a deep dive, a full audit to find all the potential risks. Then they help build the rulebook, the governance policies that are not only legally solid, but also actually fit the nonprofit's mission. After that, they train the whole team, so everyone is confident and capable. And maybe most importantly, they act as a gatekeeper, vetting any outside AI vendors to make sure the nonprofit is protected. But here's the thing, and this is really the heart of it all. This isn't just about checking off a bunch of legal boxes. The deeper impact, and frankly the reason this is so compelling for anyone looking to make a difference, is how it's all tied to advancing equity. Just look at this number, 50%.
To make sure their expertise isn't just for the wealthy, AIC Care Agents 247 offers their services at half the price of commercial competitors. 50%. That's not just some promotional discount, it's a core piece of their entire model. And let's be super clear about this. This isn't just a discount, it's a strategy. It's a conscious choice to level the playing field. It's about making sure that the small community clinic has access to the same level of AI safety and expertise as a giant for-profit hospital. It's about stopping a two-tiered system of AI in healthcare from ever taking root. And this is the why that drives everything they do. Every action, every policy is viewed through this lens. Are we using AI for public good? Are these systems fair? Are we actively fighting against bias instead of just letting it happen? It's all about protecting vulnerable people and making sure the organization can maintain its integrity and the trust of its community. Okay, so this all sounds great, but how can you really be sure it's safe? How can you trust it? Well, the final piece of this puzzle is the super rigorous evidence-based foundation that the entire approach is built on. They use something called the Swiss cheese model of safety, which comes from other high-risk fields like aviation. It's actually a brilliant way to think about it. Imagine every safety measure you have is a slice of Swiss cheese, and every slice has holes, weaknesses. No single slice is perfect. But if you stack a whole bunch of slices on top of each other, the chances of all the holes lining up perfectly for something bad to get through become really, really small.
And here are those layers, the slices of cheese. It's not just one thing. It's this whole stack of defenses. It starts with making sure the data going in is clean and high quality. Then you've got tough testing, making sure there's always a human in the loop for big decisions, and even having a plan for what to do if something does go wrong. It's all these layers working together that create real, dependable safety.
So what's the bottom line here, especially for anyone thinking about supporting this kind of initiative? This isn't just an academic idea. It's a practical, proven blueprint for action that's based on the best practices from around the world. This is how we build AI systems that are safe, that are reliable, and that we can actually trust, especially when something as important as our health is on the line. And that brings us right back to where we started, with a big question. The future of AI in our healthcare system is being written as we speak. The rules are being set right now. So the question for everyone, for funders, for policymakers, for you and me, is this: who's going to hold the pen? Is this future going to be written only by those with the deepest pockets? Or are we going to make sure that our protectors, the ones on the front lines in our communities, get to help write it too?